With an uncertain economy, the number of uninsured Bexar County residents is expected to go up. One program is in place to help improve access to medical information. And Gijs van Oort is the executive director at Healthcare Associates of San Antonio. He is here to tell us how it works. Good morning, Gijs.
Thanks, Lee.
Yeah.
And thanks for inviting me.
Well, thank you so much for being here. Let's talk about this. Let's talk about the need. It's expected to go up as far as how many uninsured folks we're going to have here in Bexar County. Is that right?
Absolutely, and we're already seeing it. It's always been a concern, I think, for the community as a whole, and I think now with the current economy, everybody's kind of expecting that it's going to go up because really addressing the uninsured is an issue that impacts the entire community.
Even before the economy started to plummet,
absolutely,
we were seeing it.
Absolutely. We've always known that healthcare is a major issue, really, and a major cost to our society. It's a major cost to you and I as an individual, but really as a society, it's a significant cost.
You say we have to really address this because in order for health costs to not go out of control, we need to do something about it.
Absolutely. And I think with the current administration, they've set some very clear targets, which I believe HASA, or Healthcare Access San Antonio, plays right into it, which is specifically dealing with healthcare technology so that information can stream more effectively from one provider, from one hospital to another community center. Historically, there have been gaps in that data exchange, and in many cases patients really became a victim of that. And the second issue is where the administration really focuses the idea about prevention, and so that we can help people before they actually have a full-blown problem. And I think again this approach can help with that.
Okay, so let's talk about HASA. How did this all start? You came about with this idea.
Well, it's actually the idea preceded me. The idea was actually generated by our stakeholders, and just to mention those quickly, those are the major providers here in the community. We have the Methodist Hospital, we have University Health System, Christus, the Baptist, as well as many community clinics, Centromed, Communicare, the Methodist Healthcare Ministries, and the Daughters of Charities. And then the last partner at this bigger point is the Metropolitan Health Department. They all realized that the way that we provided care to uninsured people was inefficient. It worked, but it didn't work optimally. And as you can draw a parallel for people that do have insurance, in many cases the insurer keeps track of really your medical history and consequently can then provide some kind of a history. For many of the providers here in the community, anytime somebody showed up without insurance, there wasn't that history there. So a physician who would have to treat that person had to go basically on the symptoms right there and then. So what we're trying to do with HASA is create this data repository that really shares the data from all the healthcare providers. And so if somebody now shows up at a community clinic or at a hospital and they say, well, sorry, I don't have a provider or a carrier at this particular point, they can use our data system now to say, oh, by the way, I noticed that you've been at the Baptist, I've noticed you've been at the clinic, and this is kind of your medical history.
So is it almost as simple as typing in your name, an ID number or something like that, and here's a history of where you've been and what kind of medication you've been taking?
It's actually simpler than that. The patient, him or herself, doesn't have to do anything except allow us to really share that data with other providers. And we've been very sensitive in the design of this database to make sure that the patient at all time is under control. So we will not really share data unless the patient has said, yes, it's okay to share. But it's based from patient perspective, there is really nothing involved after really releasing that that authorization. And basically the way we've worked it out is that all of the hospitals they send us regularly data that we put into a format that really allows this whole history really to reappear.
And lastly, I want to ask you, how do you qualify, or is there a way for you to qualify in order to be a part of this HASA?
No, at this particular point, anybody really that does not have insurance can really take advantage of it and get that care. And I believe not only does it help the physicians to provide better care, it also helps us really to provide care that is closer to home, into the community. We want to link this data system with other community services that are already available, and we will help them really become more targeted in their initiatives. So the upside of this kind of a system is pretty substantial.
Very good. Okay, well, healthcare access is available. HASA is the name of the organization, and here is where they're located, East Commerce Street. You can also call them at 210-233-7079. You can also log on to their websites, www.ha-sa.org. Guys, thank you so much.
Great. Thanks a lot.
Thank
I
you.
really appreciate that.
Well, up next, your gardening tip from Skip and something fun on a Sunday afternoon. That's after the break.